Hi, I'm Dr. Carl Olsson of Advanced Urology Centers of New York. If you or your loved one has been diagnosed with bladder cancer, it can be a frightening event, but keep in mind that there is always hope. Recent advancements in bladder cancer care have made treatment more effective than ever before and within your reach at AUCNY. With many patients, the diagnosis might come as a complete surprise. Most people don't associate symptoms such as frequent urination and dark or red urine with cancer, but most cases of bladder cancer can be diagnosed in the very early stages, which makes it very treatable. The most important thing for everyone to know is pay attention even to a single voiding of dark or red urine. While it's known that eating lots of beets or rhubarb and certain medications can darken the urine or produce a red color, it's foolish not to report the event to a doctor. He or she will perform a urinalysis confirming the presence of blood cells and may then suggest a number of other urine tests and an ultrasound or CAT scan of the abdomen and pelvis searching for the source. Finally, the doctor will order a visual inspection of the bladder by cystoscopy, which, if done under the anesthetic circumstance, may allow for a resectional biopsy of any bladder tumor that's found at the same time, or this could be deferred to a second similar procedure. What are the different types of bladder cancer? There are three main types of bladder cancer: transitional cell cancer, squamous cell cancer, and adenocarcinoma, all dependent on the most prominent cell type present. Transitional cell cancer, or TCC, is the most common and occurs in the cells that typically make up your normal bladder's lining. TCCs are thought to be related to carcinogens getting into your urine, most commonly through tobacco products, mostly by cigarette smoking. Industrial carcinogen exposure has also been found in workers in various dye-using industries like textile industry, rubber, and leather manufacturing, as well as painters, users of tars, and even hairdressers. Squamous cell cancers are more associated with chronic urinary infections like those associated with paraplegic patients or others who require constant urinary catheters. Rare parasitic infections of the bladder in tropical countries can produce both squamous or transitional cell cancers. Prior radiation of the bladder can similarly be linked to some cases of both TCC and squamous cell cancer. Adenocarcinoma is the least common bladder cancer and is often related to congenital abnormalities of the bladder. Finally, some cases of bladder cancer are familial, suggesting an inheritance feature that we don't understand terribly well now. After a diagnosis is confirmed, your doctor will need to make sure that the cancer hasn't been spread. If you've already had a CAT scan before cystoscopy, that will have ruled out any spread to organs in the abdomen, but you will still need a chest X-ray or CT of the chest and possibly a bone scan. After the bladder cancer has been removed by resection, a schedule of careful follow-up cystoscopy and urine tests will be made for you to guard against recurrent bladder cancer, starting at 4 times a year and gradually lowering to once a year. You will be strongly advised to refrain from any smoking altogether and to increase your fluid intake to dilute any carcinogen that might be in the bladder. If recurrence occurs, your doctor may advise very effective immune therapy or chemotherapy administered inside the bladder only. To help you and your family navigate through the process, it's essential to have a trusting relationship with your healthcare team. You should always be comfortable asking any questions. From diagnosis to treatment and recovery, your well-being is your doctor's priority. You can count on the Advanced Urology Centers of New York doctors and staff to guide you.